Our gift for the Sandra and Leon Levine Psychiatry Residency Program was a milestone for our behavioral health program. Having a psychiatry residency program within our behavioral health service line attracts some of the leaders in behavioral health and psychiatry from all over the country to join us. So we are hard at work at creating and implementing the psychiatry program right now. We will recruit 3 residents to start their first year in their psychiatry residency in July 2017. Bringing a psychiatry residency program enriches not just the behavioral health service line, but all of our residency programs. All of our residents in primary care, hospital medicine, surgery, they all need to know about psychiatry. North Carolina has a shortage of not just psychiatrists, but several other disciplines. Our desire to expand our residency programs to meet the needs of the state is helped with philanthropy. Philanthropy has a significant impact on my ability to do my work.
The purpose of this healing garden is another venue for patients and teammates to find a place of healing and comfort and peace. Part of what CMC Mercy has implemented is that patient family-centered care model and integrative healing. There's some peace about the rhythm of nature. When you're out here, it just relaxes you. Dr. Benjamin here he's a fixture. He's the real deal. He was well respected and loved by both staff and physicians. Mr. Greenspan challenged the family to help raise funds to honor the Benjamins and the Graces as well. So great, but without them, this would not be a reality. Healing spaces in the literature says if there's nice healing environments that relaxes and calms the patients, it lowers blood pressure, speeds up healing, and lowers the length that somebody spends in a hospital. So the impact of this garden on the teammates and patients has been significant. I see teammates out here eating lunch, just taking a few minutes to relax and enjoy nature. It gives them a place if they have a stressful moment. They just need 10 minutes to come out, meditate for a minute, to center themselves. Same for family members. If it's tough, they just need to get out and take a moment. It's a great environment to do that.
The webcams really gave us a sense of relief because we had prepared the 5 and the 2-year-old back home that there's going to be a baby coming home and living with us, and there was all this excitement. But when we could open up the computer and say, hey, come here and look at this. And when I have my 2-year-old who looks at there and says, baby brother, and goes to kiss the screen, it was able to bring all the family together.
When the doctors first told us that we had access to the neonatal view, we were amazed that they had this type of technology available and super happy because both my husband and I work a lot. We like to use the neonatal view several ways. We like to use it on our laptops at home, and then also on our cell phones when we're on the go. It's nice to just pull up the cell phone and be able to show family or friends wherever you are how Caroline's doing. Grandparents love it. We actually have family in Germany that's not able to be with us, and they love being able to view her from across the Atlantic. So we're very thankful to be able to share this time with them, and it's kind of like family bonding even though we're not all in the same place.
Well, survivorship really covers almost everything from nutrition to exercise to supplements, really mind, body, and spirit. What does that person go through when they're diagnosed with cancer? I always say that we have our oncologists treat the cancer, we treat everything around it involving that patient. We empower that patient to get through chemo, we help them deal with side effects of treatment, we help them recover from treatment, and then we help them decrease risk of recurrence down the road. This department started in 2012, before we even had this building. And since that time, it's grown exponentially because we have a philanthropic base. Thanks to Booty and some individual donors, we have one of the largest programs in the country. And that's only because we have such philanthropic base. We initially knew that we wanted to have acupuncture as part of our program. We knew it was a costly service, and when we started it, most people couldn't afford it. So we got a little seed money from a donor, and we were able to say, how can we increase access and decrease cost? So what we did is we developed this whole model of a group acupuncture setting, which then decreased the cost, and people started using it more frequently. We're really changing the face of survivorship. In the past, survivorship started after a person was treated when they went to recovery. We're starting our treatments and our programs at the time of diagnosis so that we're involved from the very beginning with that patient through the whole continuum.
We are looking at the blood flow in the arm of a child with an elbow fracture that needs surgery. This is a really common injury, and only a small percent of kids actually have an issue with the blood flow to the arm. But those are the kids that we worry about the most for long-term outcome. If blood flow is not adequate to the forearm, they can lose function to the forearm muscles. They can actually develop contractures in the forearm and the hand. They can also develop what's called a compartment syndrome, where they're not getting adequate blood flow to the muscles within the forearm, which will lead to later poor outcome and hand function. So we've already enrolled about 100 kids in this research study, and so this is really the first step to even see if we can measure oxygenation or blood flow to an arm below an injury in kids. Looking at the early data, we were able to do that, and we were very successful. Our goal is that hopefully this will lead to an additional multi-center study. I guess I'm pretty young still in my career, and so to have an opportunity like this early on from a research standpoint is really, really key, I think. This particular study and the generosity from the foundation has really helped us to achieve a lot of our initial goals to help to lead to additional studies down the road.